Let me introduce myself. I am Dr. Iqra Ahmed, and I have been actively responding to you on the group. Currently, I am working as senior registrar at University of Childhood Sciences in Lahore, and I have done my FCPS and I've cleared my MRCPCH in September 2023 from Pakistan Center. And since then, I have been involved in teaching of some friends, and now that I have joined this forum of MedPrep, where we are having these routine sessions. And I hope these sessions are helpful for you. And I'm really glad to see a lot of good response on the WhatsApp posts and also on the Telegram groups, and especially in the free sessions. So today we have almost like 18, 19 participants, and since we were about to start on exact time. So our aim today was to do a communication station. And as I asked on the group that what topic would you be interested in, so a lot of you decided to have a talk on the ambiguous genitalia, as this is one of a very sensitive issues, very sensitive topic, and you have to be telling the news very carefully. So we can cover a lot of points regarding the communication station, and we can clear a lot of confusion regarding that in today's session. Our so who volunteered? Dr. Murtaza, I think. Dr. Murtaza, hello, are you here?
Yeah, hello, ma'am. I'm here.
Yeah. How are you?
I'm fine, thank you.
So are you planning to give exam anytime soon?
Yeah, I applied for Diet 3 2024, but I couldn't get a slot, so I'm planning for Diet 1 in India,
Oh,
2025.
okay, right. So you do have been in practice and preparing. Ex
Yeah, I have started like 2 3 months back.
Yeah, that's good. Right. So let's see. As all of you must know that in the communication station, you are given a paper, a sheet outside your station, and there's a scenario written the on that station on that sheet, and you also have a paper and a pencil with you. So you get 4 minutes, but we in the session will be giving you 3 minutes. In those 3 minutes, you are going to read the scenario. You are going to make a summary in your mind. Be sure to remember the names very carefully, maybe write them down and just revise them in your mind so you do not confuse the name of the baby or the name of the parent. Secondly, you should be clear about the opening sentences and whatever you want to tell. If you want to deliver the talk with the example of a diagram, you can do that as well. Once the bell rings, you give that sheet to the person outside, but you can go take that paper on which you have written inside. Inside, there's going to be no communication with you and the examiner. It's you, and in front of you, there's a role player. You're going to go inside and you are going to sit on the chair, and then you're going to start right away talking to the role player. So the total station is of 9 minutes. At 6 minutes, you are given a bell that 3 minutes remaining, which means that this is the time where you should be just summarizing out the things. So I'll start the scenario and I'll start the time. Till then, more people can join and then we can start it. Is that okay with you? Are you ready? Dr. Murtaza, hello. Can you guys hear me? Dr. Murtaza, are you here?
Yeah, fine, ma'am.
Okay, fine. I'll
Yeah,
just tell a scenario and I'll start the time. Oh, can you see this?
yeah, I can see this.
Right.
Yeah,
Your 3 minutes have started.
okay.
Okay, so your time's up. Let's start.
Hello, this is Dr. Murtaza, one of the pediatric registrars on duty today.
Hello, doctor.
Am I talking to Mr. John, Mr. Adam, father of John?
Yeah, doctor, that's me.
So, Mr. Adam, I am here to talk about your baby today. So, before we go ahead, would you like someone to accompany during our
Okay.
talk
Okay.
today?
Can we just hold on? Okay, I'm sorry that I
Yeah,
mentioned the name of the baby in the scenario. That shouldn't have been there. Yeah,
ideally should not
because
be there. Okay,
obviously when you name the child, it's one of yeah. Because that's my mistake. Yeah.
right.
So we'll just start again,
I,
and presuming that
sure.
you're just talking to Adam, father of a newborn baby, and there's no name.
Right,
Okay,
right.
that's my mistake. Yeah.
Okay.
Let's start again. Yeah.
Good morning. This is Dr. Murtaza, one of the pediatric registrars on duty today.
Good morning, doctor.
Am I talking to Mr. Adam?
Yeah, it's me.
So, hello, Mr. Adam. I am here to talk about your baby. Before we start, do you want someone to accompany in during this talk?
Oh, no, doctor. My wife is in the post-recovery phase. She's in the ward, and it's only me. You can talk to me.
I do understand. And before we go ahead, I have made appropriate arrangements that no one disturbs us during our talk about your baby today. Is
Okay,
it?
doctor. That would be good. Yeah.
So, Mr. Adam, how is your baby doing? Do you know how, did you meet him today morning?
Yeah, doctor, I mean, I went there and the baby was doing okay. They told me that the baby is feeding fine and he's doing well, but I'm really confused. I mean, no one has really told me that is it a baby boy or a baby girl? And my wife, she's really upset on this as well. And I don't know what's happening. Doctors are just going inside and coming outside, but they're not telling me anything. So I'm really confused.
I do understand your concern, Mr. Adam, and I'm here to talk about this only about your baby. So, unfortunately, it's like when we were examining your baby, we could not really determine the gender of the baby actually, whether it is a boy or a.
What? What does that mean, doctor? I mean, a baby is a boy or a girl. What do you mean you cannot determine? Why is that so?
Your concern is quite valid, Mr. Adam, but really at the present situation, we are not able to determine whether it is a boy or a girl. So, but we are working on it,
What
and
can be the reason? Is it something worrisome? I mean, this is really disheartening to hear. What's wrong with the child? Is it something really serious?
uh, I'm here to make the things clearer for you, Mr. Adam. So, as of now, the baby is doing good. You have met him in the morning. It is feeding well, and and the vitals are stable. And but the thing is like not very clear as of now because we need some more time to decide about, and we need
So,
to
doctor,
run through.
I'm not understanding. How are you going to decide? I mean, you're still not sure. It's been some hours, and you're still not sure. What are you gonna do for that? And what's the reason for that? I can't understand.
Yes. So the reasons which we can see, like sometimes like it can be like normal also. The private parts can be normal due to swelling which was in the when the baby was in the mother's passage and there was like it was there. It can be due to some swelling also. It can be due to some like defect in in the gene of the baby which
What?
can be there.
You're saying that my baby has some gene defect? Doctor, he was totally normal. We did all the scans and everything, and nobody told us that there was something wrong about the baby. And I don't know what you're talking about. Why did this happen? Oh my God, what am I gonna tell to my wife? She's gonna be so upset. How am I gonna handle all this?
I'm really, uh, I really appreciate your concern. and I'm here to make the things clearer for you, Mr. Adam.
Yeah, so tell
So,
me, what are you gonna
actually,
do now?
right. For this, for your baby, we'll be running a few tests for him, which will include a jelly scan for his abdomen to see for his
Okay,
organs. We will
okay.
also do some blood tests to see his like how his salts are there in his body and the level of sugar in his body,
But
and a
why are
few
we
other
doing,
blood tests.
doctor, why are we doing the salt and the sugar test? I mean, the issue is about the gender of the child, and you're telling me that you're gonna do salt and sugar of the baby.
Right, that's quite an intelligent question, Mr. Adams. So, if I can help you with a diagram here, I have made a diagram for you. So, in this
Okay.
diagram, you can see that there are two bean shaped kidneys in our body which produce our pee, right? Am I making myself clear?
Yes.
So, above these pee making machinery, we have two glands above it, which are known as
Okay.
adrenal glands.
Okay.
And this is the like gland which basically controls our sugars. It also controls our salt in our body, and it
Doctor, I
also
think
helps.
that's way too much information for me. I don't think I'm ready for this now. Just tell me that how early can you decide that is my baby a girl or a boy? And because we are getting calls from our relatives and they're about to visit us, what are we gonna tell them?
uh, True, Mr. Adam. So it the best is like we have to wait for some time and let the results of the tests come,
Oh, but
and
what am I
then
gonna tell them? I mean, how am I going to deal with all the questions? What do I tell them? And what am I going to name my child? I mean, how do I get my baby get the birth registration?
yeah, the best will be like as I just told that let the results of the tests come. We will be updating you from time to time about the things. Then only we can like it will be better to
And
name
what
the
and
child and
how early are you gonna do that, doctor? I mean, I really want to this issue to be resolved.
so we'll be doing the test when the baby is like 2 days after 2 days old, because some of the test results might not be very conclusive if we do it before
Oh,
it.
doctor, so we have to live in this confusion for the next 2 days and then next few days. That doesn't sound well.
Mm, I really understand your
Yeah,
situation,
3 minutes left.
Mr. Adam.
Yeah, doctor, I mean, why can't you do this early?
Yeah, as I told that we have some tests which we have to do with the results of which might not be very clear. The jelly scan we will be doing it tomorrow, which will be the earliest. But the blood test we have to wait some of these because the results won't be very clear.
So who's
And
gonna decide it for the baby? I mean, are you gonna decide it that it's a baby girl and a boy? And doctor, tell me that is it something because of our family or our genes that you mentioned genes? This means that this is something because of us, because of the parents?
yeah, Mr. Adam, I'll answer both of your questions now. So I am not the one who will be deciding alone about the gene of his doctor. A team of doctors, which will include the gene doctor, the gland doctor, the baby doctor, and the surgeon, will be there to decide on the gender of the baby, first of all. And
Okay.
second, as of now, with regards to your second question, like is it because of gene, presently I am not in a situation to give you the answer because we will be running the gene test also to see if it is alone due to the gene or is it due to some other cause. I hope I am making myself clear enough, Mr. Adam.
I don't know. I'm so confused right now. I'm so upset with all this. This is a lot. I mean, we just thought we were happy that we have a baby. We had this baby after so many years, and you have given such bad news. I don't know how to tell this to my wife and what's gonna happen to her.
Yes, Mr. Adam, I do understand, and we are all there to help you out in this process. And I'll be helping you with some trusted websites and leaflets which will help you more understand this condition in a better manner. Will that be fine, Mr. Adam?
I don't know if I just want some help for my wife because I don't know I'm in a situation to read anything right now.
Yeah, this is really a difficult situation, and I really understand it. And if it is that situation, we can arrange some professional help will for your wife when we are like discussing the things with her,
Yeah,
and we will be, and it will be better if we meet again regarding this topic.
yeah, I
Will
think
that be
yeah, I think I want to meet again and ask a few more questions. I'm really
right?
upset.
Yeah, Mr. Adam will be arranging a meeting with our consultant also regarding this. And is it anything, or shall I like summarize the things which we have discussed today with you, Mr.
I don't
Adam?
know, doctor. I think that's enough, doctor. I'm done listening.
Right, right. Thank you, Mr. Adam, for giving me the opportunity to talk to you about your baby, and we are
The
doing our
time's up.
best. Okay,
Yeah.
thank you.
So, yeah, thank you, Dr. Murtaza, for being uh, here and coming up and participating. So, overall, I would say that you had a good approach and you knew all the important points and probably you knew the answers to a lot of questions that were asked. Starting from the initial thing, a few points that I noted during okay, before that, before I start, I want anyone to share their experience. We have a good number of participants here. We have Iqra Ahmed. Just unmute and give.
Yeah, Dr. Murtaza forgot to congratulate the mother. That was very important because baby was doing well, except for the problem with the genitalia. So that would give something, some positivity to her.
Yes, that's a good. Yeah, that's a good point. Even I noted that. Yes.
Yeah, yeah. I was in a dilemma actually in this case, whether to congratulate or not, because it's like baby
Yeah.
was
So
fine, but
yeah, the thing
like
is, whenever you
generations
have a scenario of a
a little.
newborn, even if you're if you're going to break even a bigger bad news to the child has something else as well, or any other issue, you always have to congratulate the parents because you have to make a rapport. Be- Initially, if we start in our introduction, you give your introduction. I would say you can little bit work on your rapport sentences. That is something that I want to tell to all of the participants who are here. Do practice on your rapport sentences. Just saying them hello, how are you today? That doesn't look nice. That looks very casual, and that's something because in a lot of scenarios, when you're saying that the parents are upset or the mother is upset, you are gonna ask that how are you? And they might just tell you that they're not in a good state and everything, and the discussion might go into that in that form. So work something in for your repo sentences, especially in the communication where there's communication related to the neonate. Always congratulate. And ask about the condition of the wife. If the father is there, ask about the wife of the child's mother. I hope how's the mother doing? I hope she's recovering well after the birth, after giving the birth. Or even if you're talking to the mother, you can ask them that hope the post recovery phase is going well and you're doing okay. So introduction, your repo needs a bit more of a practice. You need to have some more good sentences depending upon the scenario, definitely. Obviously, when you are going to have um a case of leukemia or something which is very bad, in a case sense of breaking bad news, maybe you don't be very cheerful at that time. But here, because the baby is doing well and baby isn't very sick, and obviously there are confusions that are coming up, you have to congratulate the parents, right? Next, you have to be very clear about telling your role, that what are you going to talk about. You did mention that you're here to talk about the baby's health, and but you need to be more clear about that. One thing, it's very common in a lot of scenarios. I've heard a lot of people saying that I have made arrangements that we are not disturbed. Personally, I feel that's something very unnecessary because that just I think wastes your 15-20 seconds, and it's not a very it's not a necessary line that you have to talk to, you have to tell. Maybe you can use this line when you're talking to a colleague and there's something about the colleague that you have to discuss, but in other scenarios I wouldn't recommend using this specific line that I have made arrangements and all. You can just go without that as well. Okay, so your introduction, and then your rapport building, then your role, telling about your role, and then you did ask about that, and then you just asked about what was the knowledge of a parent, and then they told that it's not specified. Yes, initially you were very careful about that. You don't have to use any specific pronouns of her and his. I know it gets very difficult, and it's really hard, but just try as much as possible to use the word the baby, rather than that we are going to do some tests on the baby and we are going to do jelly scans on the baby, rather than saying that we are going to do some tests on him, or his tests, or his jelly scan and something like that. Because obviously I know it's really difficult, and that confusion came into out, it becomes a bit prominent in your scenario as well, because at times you were saying it and then it comes out to be his. So that is something that we need to be careful about. So in any of these scenarios, if something like this comes in, and then sitting outside, you have to make up your mind. I know there was a bit mistake from my side as well, because I mentioned the name. Just totally, it was, I just wrote the scenario in a normal sequence, how we usually do. But obviously your name is won't be given, because that's also that's going to be an issue when you are unclear about gender. Okay, so regarding this, the scenario typically goes on like this, that you're going to break the news and then they're going to be very upset. And then um this is something we s- always use some comforting sentences to the parents, right? I do understand that this must be really upsetting for you. And yes, the when the father said that, oh, we were very happy, so you could have said that, yes, that's the thing about it, you should be happy because the baby is otherwise doing well. He is taking the baby is taking the feed, and the baby is doing well in all the other things. The only issue we are having right now is to have determination of the gender right now, which in some cases can just be a normal part, because the private parts, they can be swollen, and by the time we see them tomorrow, it might just be clear that whether it is the private parts of a baby girl or a baby boy, and there's nothing to worry about at all. But at the same time, we do need to do some tests to make sure that we're not missing out on something. And this might be due to one of the, you can take the name of the disease if you're suspecting, because you were trying to tell about CH, right?
Right, ma'am.
Yeah. So maybe it's always good to mention the name of something that we might consider one of the disorders, which is called congenital adrenal hyperplasia, if the parent is asking more about it. Because your first point in this scenario is going to be the way you said, that it can be, it can be a normal variant, it won't just be swelling, and it might just get over. But we need to be sure that is there something else as well, and for which you tell that we are going to do the gene testing, and then we're going to do this, and this well. Regarding the explanation of the adrenal gland, yes, that is mentioned in all of the keys that usually that are going around. But that totally depends on the parent's response. You need to see if they are asking a lot of for it, or they're not asking for it. Maybe they just get so depressed after you tell them about the diagnosis that they're not ready to listen to any of the other things, and maybe and they just want to know that how are you going to diagnose something. So that really depends on what the questions they ask, right? Other than that, obviously, when the parent is always remember that when a parent is asking 3 or 4 questions at a time, you can just use, ma'am, I can understand, or sir, I can understand, or yeah, or Mr. Adam, I understand that you have a lot of questions. Let me clear your queries, or let me answer your questions one by one. Because it happens that when the parent is worried, the role player is worried, might throw 3 questions on you, and obviously you might just answer one of the questions and then just move forward, and then they keep returning to those questions again and again. So always that, yes, I understand. um okay, about the intelligent question, I don't think talking to the parent and saying that intelligent question would sounds very good. That's for a colleague usually. You can obviously, you're good, you did use good sentences that your concerns are valid and understand your concerns. I know it's a difficult situation, especially in the end when I told you that I need some, like my father, like my wife needs help. So you did mention that we can give you some help and we are here for you. And you did ask about, told me about the leaflets or the websites. but you need to summarize the case. You asked me about the summary in the last 5 seconds where I said that, yes, I'm just done. But as a part, when the 3 minutes are done, just make sure that after 3 minutes, you are just wrapping up your sentences and there you're coming towards the end so that because summary does have a mark. And if you miss that, it might cause you to lose 1 mark or maybe 2 marks. So always make sure that you are summarizing. When you were told me that you were going to give me leaflets and something, before that you could have summarized that. Let's just summarize that what we have discussed today. We discussed that we are unable to identify the gender of your baby and whether it's a baby girl or boy. We are going to run some tests and then we'll be telling you as soon as possible. Otherwise, you do have the right knowledge and the right answers to almost all of the questions. But I think a little bit of more practice, a little bit more comfort, and using some additional good sentence some additional sentences of comforting sentences would have been good. What do you, yeah, someone else. So what's your opinion about this? How did it go? And did you have any confusions or you want to ask anything?
With
About
regards
how
to,
long they had to wait for the genetic test, I think we should be more clearer on how many days the report is going to come.
Okay, so regarding that, where did you read that we are going to do the test after like 2 days?
in
Where is it mentioned?
guidelines, it is written. In guidelines, it's
Okay,
written that.
can you just send those guidelines in the group and maybe we can discuss on that in the group as well, because
Sure,
this is
sure.
something that I don't think that I have gone through, because usually it is a good idea to tell them exact period of time, because obviously you're going to do some tests and you can just say that we are going to do as soon as possible, because the salt and the electrolyte test, sugar test, you are going to do that obviously right now. You're not going to wait for that. And the other, you're going to obviously, and then don't tell that we are going to do the jelly scan tomorrow. Don't give a specific timeline. Okay, you will just, obviously they are very worried and they're upset. So just tell them we are going to do them as soon as possible. We are going to let you know as soon as possible. That's the best approach in this scenario. If you
Right.
have read that 2 days guideline somewhere, just let me know. Just let's share that in the group and maybe we can have a discussion on that.
Sure, sure. All right.
Okay. So how did you think that you did and what's your...
Mm, yeah, the points which you have highlighted, like I really feel that I was lacking on those. Just the knowledge part I was giving.
Yeah,
Those things, right.
that's the one thing that I need to focus for everyone, because usually whenever we are preparing for exam, we kind of just read and learn that we have to memorize and all those things. In the MRCPCH exam, it's not about how much you know. They're not checking that you know 10 things. They're checking that you know 5 things and you are able to tell those 5 things. You're able to deliver that or tell that to the role player properly in a very sympathetic and an empathetic way, right? You don't have to bombard them with a lot of information. Just be very careful. Obviously, I know it's difficult because obviously we are not sitting face to face. You cannot read my expressions. When you are sitting with a role player, you're sitting with a live person, and whenever the expression is showing, I'm sure that if you're actually talking to a father and he kind of gets sad and he gets tears in his eyes and everything, obviously you're going to stop at that time and you are going to comfort him and you're going to say some word and then you're going to move forward. But obviously in these live the online sessions, we are unable to get those physical signs, but we can work on our tone. We can work yeah, one other thing I would say that i I felt that the tone was a bit of monotonous, right? So in the cases when you're discussing and when you're comforting and you're like having some these kind of scenarios where the parent is upset and everything, this it's always a good idea to just lower down your voice at times and then maybe just get it up at times. Like, I'm really sorry. I understand that you are in so much pain, or I understand that it's a lot for you and for you and your wife. But let me tell you that we are here for you and we are going to help you. Like, you have to make a bit of a change in your tone and make that it sounds a bit natural, and it doesn't sound that you are just talking in one tone and you're just here to answer the questions. You have to just make a connection with the role player as well. Yeah, so okay,
We
someone
have to
mentioned it.
keep the baby in the hospital. If at all we are suspecting CAH till the screening results are available, should we be communicating that as well?
I think if the parent asks that, because obviously when the parent is asking that when are we going to know, and you're going to tell them as soon as possible, then obviously they know that since till the results come, the baby is going to be here for the final diagnosis or the final judgment of that. Till then, obviously the baby will be here. If they ask you again that how long, then obviously you can just say that we're not sure about this as time, and maybe because as I told you that it could just be a variation of normal, and by the time tomorrow or in a day or so, we might just
So
discharge
about
the
the
baby
feeding,
early.
if we are like expecting a hypoglycemia, shouldn't
Yeah.
we detail about those things?
Okay, so basic concern in this specific scenario we were talking here was like breaking them about that about that they're unsure about the gender, about the genitalia. It was not that the baby, it might have come in the cases where they may say that the baby has been diagnosed as CH, and now you have to tell them parents about that. In that specific case scenario where there's a final diagnosis of something and then there's a complication, then we'll be telling them. Here the main agenda was to tell them that we're not sure about the gender and we're looking for the causes. We are not going to tell them that it's going to be this. We're just going to give an idea about what else can be present.
So when the father was upset that he cannot tell the gender, like the ideal time for waiting, like genetic test, the results are out. So till then, how to console the father that you have to wait for 3 days, or how much of time it takes for the genetic results to come?
Okay. Obviously, we cannot give them a timeline. It's since you might have seen a few of our discussions yesterday, because things happen differently. You cannot tell them that this is going to happen very soon or very early. This is how your voice, your concern matters. This is how the parent is going to be get consoled, because it's not just about the words that you are telling, it's about the way, it's about the tone that you are telling it with, that the next person realizes that yes, you are understanding the concern or the worry of the parent, and you are definitely trying your best to do get the thing solved as soon as possible. So obviously you cannot tell them one timeline. So we got a question for the registration and about informing other family members of the gender. We can say that we will need to postpone the registration and can confirm for this African. Yes, for the registration, usually it's written that it can be done within a few weeks. I also read somewhere that it's written that you can get the baby registration done within 2 months. You do not have to get the registration of the baby done right after the birth. There's some time that is given. So you can tell them that for that regarding the registration, we do have a time of a few weeks in which we can get the baby registered. So till then, the results will hopefully be out and we will be sure about the gender and we can proceed with the registration later on. Regarding the family members, yes, in the same way, you have to tell them that you can just tell the family members that we have been blessed with a healthy baby and the doctors are a bit unsure. And as soon as they are sure, then we'll be disclosing the gender. Some of you might have seen this a video of this similar scenario present on YouTube of the London School of Pediatrics about the Mingus genitalia. You guys can go through that video as well. It has some good parts. Some things are different, but it has a good part about how to answer all these questions. You can go through that as well, and that can clear your queries. Okay, someone wrote in the chat that it is correct. Blood needs to be done a few days after the baby was born. We usually send baby home and comes back to follow-up clinic for the blood test. Okay, so whoever has written that, can you just whatever these guidelines are, can you please share them in the group so that
I
we
have
can?
just shared the guidelines, ma'am. I have shared
Okay,
the guidelines in the
okay,
group.
I'll go. Okay, I'll see that as well, and then we can just Okay, so does anyone have any other questions?
Ma'am, only the 17-hydroxyprogesterone test needs to be delayed, but other things like the karyotyping, the jelly scans of the abdomen,
Yeah,
those can be
yeah,
done, and that
yeah.
will give us a
And
fair idea what the internal organs are. So,
right. So obviously
yeah.
that's the thing, that you can get the ultrasound done and that can tell you, and then you can get the other blood tests done. Obviously for the 17-hydroxyprogesterone, you can tell them that we're going to do certain tests which needs to be done early, and maybe some tests have to be done a few days later. Because you see, to determine your gender, you don't have to get 17-hydroxyprogesterone level. That's for the diagnosis of the CAH and especially the cause of that, right? For the other things, for the gender of the baby, like is it the baby's XX or XY, right? That you can obviously send and you can get the test in the few days.
Nowadays, karyotyping results come within 2 days also in UK.
Yeah, that depends on the center to center. And so that's what I'm telling you, that right now we're not disclosing the final diagnosis of congenital adrenal hyperplasia to the parent. We are just telling them about ambiguous genitalia, and obviously we are just telling them that we are going to do some tests. And trust me, this is not of some of the scenario where they're going to get you that how many days or something like that. It's more about just handling the response of when you tell the parent that the baby's gender is not defined, they're gonna be upset about it, and you have to manage that upset, right? So you just have to touch things, and then it was a good thing at the end that you said that we can arrange a meeting and then we can discuss things later on as well. So that's a good approach to answering all of the other questions. Okay, so right, you did mention avoid unnecessary admission to the NNU, check serum electrolytes and plasma glucose. Uh, Right. So that's what we discussed, that we won't be admitting the child unnecessarily right now since the baby is doing fine. If they had mentioned that the serum glucose and serum electrolytes have been done and they are fine, then obviously then you don't have to admit the child. But in certain cases, when obviously the tests have to be sent and the baby is just a few days, few hours old, then you can just tell that we are gonna see and look at the child, and maybe we can tell you about the things later on. Obviously, we're not gonna keep the child nurse.
Dr. Iqra, in the Breaking Bad news, do we have to draw the diagram as the parents are already depressed and, we are breaking the news? So is it a good idea to draw a diagram and make them focus on that diagram? Or should
Yeah,
we,
so that is something that's what I said, that a lot of notes that have been circulating around, they have that diagram going on, and I think everyone obviously reads them and then they have this thing in this mind. But the Breaking Bad news scenario can get very bad in a sense that the parent is so unconsolable that you are unable to let them feel like they are unable to feel better. That happened to one of my scenarios when I did the Breaking Bad news of acute leukemia to a mother, and she was sobbing and crying so much that I literally had to ask her that, do you want me to discontinue our discussion or do you want me to proceed further? But then she said, okay, yeah, let's proceed further. In that case, that's what I'm saying, that if the parents is settled, breaking bad news, your first task, your main task is to carefully, gently tell the breaking bad news, wait for the response of the parent, and then
okay,
console the parent, let them feel
okay,
better. After that, it's depends upon the response of the parent. Where is
okay.
the parent taking you? What questions? Because obviously they have a typical, they're not random people. They have a typical, obviously they have a key to their themselves
Yeah,
and they have
yeah, obviously. Yeah.
yeah, so they have some specific questions. Like if I tell you in the mother had questions that why did this happen? And is my child going to die? Is my child going to die? And is there any treatment
Okay,
available? So you had to answer.
okay.
In that specific scenario, I did not draw a long bone and told the parent about that this is how things.
Hmm,
But as a
hmm.
safe option, you can draw a diagram outside if you have something in the mind, right? So
Okay.
if you get that opportunity and the parent is willing to get to know the cause in detail, you might tell them a bit. If not, then it's not necessary. Don't just force to tell the information that you are. That's different in other scenarios. Obviously, this is breaking bad news. In some of the cases, in the scenarios which are information giving, like a diagnosis has already been told to the parent, and now the parent has come to know, discuss about the diagnosis and the treatment. In that cases, obviously, you need to have a good information, like one of the cases of prolonged jaundice, and the mother know that the baby has jaundice, and now the mother wants to know that what can be the causes. There, you're going to tell the mother about 2, 3 causes, like this can
Okay.
happen, and this can we do. But in breaking bad news, it's mostly about breaking the bad news with empathy, wait for the
Okay.
response, and then console the parent.
So it's all upon the response. If they response in that way, then we need to give them knowledge. Otherwise, we just have to, empathy
Yeah.
and console them.
In this kind of scenario, you have to lead wherever the role play leads you. You have to go there. Don't try to put a lot of things from your side in that.
Okay. Fair enough. Thank you.
Okay, so with this, we'll be ending our today's session. We have a few questions, and I'll be answering them in the group because, yeah, I have to just be ending the session right now. Thank you so much, everyone, for joining. And whatever questions all of you have, just post them on the WhatsApp or the Telegram group, and I will be answering all of these there. And I hope it was an informative session for you. Do give feedback and do give a response on the group as well. And we'll be having a session next week, and we'll be having a new volunteer next week as well. Thank you, everyone, for joining in.
Thank you. Thanks a lot.
Thank you.